Hello and welcome to the DVRC orientation video, if we want to call it that, for 2023. My name is Laura Valecki, and if I haven't met you, I hope to soon. I am the medical team lead for this year, so helping to try and coordinate the program and make it the best that it can be. I am a nurse who works out of Regina General Hospital. I'm the clinical nurse educator for day surgery and recovery, and I have been at camp for many, many years since I was a kid, and then as staff later on, and then as the nurse for many, many weeks. So I love it out there. For those of you who it's your first time out, welcome. I hope you come to love it out here too. It is truly an amazing ministry and a great time that you can spend by yourself if you come by yourself, or even if you bring your family. I hope it's going to be a blessing to you guys as well. So this is going to be a video that kind of explains what the program looks like at Dallas Valley and just a few key concepts. In it is also a few videos and resources that hopefully you can access later if you need them, as well as a discussion of kind of the schedule and what some things look like. When you arrive at camp, if it's your first week, we will definitely have another nurse out there to help you kind of get you settled in and feeling comfortable and give you a tour of the place. It's fairly big, and we want you to be comfortable on the premise so you know where things are and what your role is. So let's dig into that. A home approach. So we're really caring for kids like they come to play at our house. So what I mean by that, when they come to our nursing stations around camp, it's not like they're stepping into emergency and we're setting up sterile techniques and, doing crazy things. It's more like we are nurses who have kids, and we care for the other kids that come to our house like they're our own. So when they come in, we treat their boo-boos and give them medicine if they need and various things like that. But it's a very comfortable home approach. There we go. Also, note sometimes my formatting's a little off. I exported it to PDF and then put it back into PowerPoint. I'm not very techy, so I didn't do a super good job, but I'm doing my best. So the common things we deal with, I'm just going to run through them quickly and then we will cover them a little bit more. We do a lot of cuts and scrapes. There's lots of bugs out here, so we have kids coming to us with issues related to that. We have a lot of homesickness and kids that are just not used to being away from their parents. We have lots of sprained and twisted ankles. We do have possible breaks that we assess for and some breaks, stuff like that. We often have kids that get too much sun and aren't feeling well because they've just been in the hot sun for too long. Lots of random pain, whether it be headache, menstrual pain, aches and pains for other reasons. We have kids with allergies, whether they're treated, scheduled or not. We do have kids that come in with cold and flu symptoms, and then we also do have to deal with the mental health of the patients as well. So cuts and scrapes. Clean technique is okay. So in each of kind of like a main drawer in each one of the nursing stations, there will be a pack of kind of 2x2 and 4x4 gauze that are just a large pack. Those are great for cleaning up cuts and scrapes. There'll be a little bowl there. Water is perfectly okay for cleaning. These are healthy kids that have scraped themselves in the what I call the non-germy dirt. It's way less dirty than our hospital-y dirty, and so clean technique is totally okay, and that's generally how we bandage up most things. You will find some gauze and other bandages that you would find in the hospital. Feel free to use those. But just some gauze and band-aids is okay too. Lots of bug bites. So there is wasps and stuff like that you'll have to deal with. Cutting a potato in half and putting it to a wasp thing. I've heard that works. My son swears that it works because he's been bit by a wasp a few times. Mosquito bites, if they have lots of them, often I'll give them a little cup of calamine lotion with a little cotton ball on top. That they can dab on if they want something like that. We do have afterbite and other things as well for that. Ticks is one we get a lot, especially if you're in the first few weeks of camp. You'll notice it more than in the back half of camp. There is a video here on how to remove a tick. Basically just go as close to the head as possible and just pull with slow, even pressure. It does take a lot of pull, I'm not going to lie. but you don't need to burn it out or Vaseline it out or twist it out. Those are not recommended, only because the more we manipulate it, or if we try and like kill it or suffocate it out or whatever, it does release more of its saliva into the wound, which we are kind of trying to avoid. Ticks have the possibility to carry Lyme disease. That being said, the risk in Saskatchewan is really low, but not zero. So 13 and 36,000 ticks submitted contain the virus that has Lyme disease in it. So it's not really that much of an issue. Most of our ticks are American dog ticks, not the bad blackleg ticks, but there is a little picture here that you could see. You know, I pulled ticks off my son that he got from Dallas Valley this year, and they were American dog ticks. So that's good. If you ever do, after you've pulled one out, and then in a few days it's getting this big red bullseye looking rash, so like a big red ring around it, then they should go in and get treated. Or if they're all of a sudden having fever, chills, it's a very generalized symptoms. But if a few days after a tick bite they do have that, you can send them in, although the risk is fairly low. Sprains and breaks. I would say this is sometimes what I consider one of the hardest things to assess out at the camp. We do have lots of kids that roll their ankle in wide game and stuff like that, and are hopping around. And assessing kids is its own kind of special challenge at times, because they're also kind of worked up about it and stuff like that. I find the best tip for assessing them is to assess them once while they're looking and seeing kind of what you're doing, and then a second time really like maintain eye contact with them, or if there's another counselor there, have that counselor have a conversation with them that totally distracts them, and then assess it while they're distracted. And that's when I find I get the most obvious, like, oh, ow, yeah, that hurts there, as opposed to just a generic, ow, it hurts everywhere, because they're kind of overwhelmed by the injury. Here are some great resources. They're YouTube videos. I hope they play off the video. If not, feel free to just go Google them on YouTube. It's easy to find. They're a great resource. So Ottawa ankle rules just kind of rule out what maybe should be x-rayed and what shouldn't be x-rayed. We do this year, we're very blessed to have a nurse practitioner that's joined our team, and her name's Adrienne. She works out of 4 Directions, and she has the ability to order x-rays and assess kids. So if we do have issues of things that we do feel need to be x-rayed, she is able to order that for us and then potentially see them kind of the following morning, because it usually happens at night, and stuff like that. So if you do have that kind of issue, feel free to text me and we will kind of arrange that. But that's a great resource. Another thing is that there are a couple crutches around camp, one at each nursing station, but as a general rule, we do not give out crutches. And the reason for that is if they can't weight bear, they should be x-rayed. And crutches are contagious. So if one kid has crutches, they all want crutches. They're a bigger risk of falling down and actually hurting themselves on crutches, especially with all of our stairs and hills and uneven ground. So we avoid giving crutches. Conceivably, if someone got an x-ray, got assessed, and then was recommended that they could come back out to camp but not weight bear, conceivably we could use it then, but generally speaking, we don't give out crutches. However, we do give out lots of ice packs. We have lots of tensors. We can wrap an ankle in a tensor to kind of bring down some swelling and stuff like that if there is some soft tissue swelling. And then just the rest, ice, compression, and elevation. We do that a lot. My other big trick for this, as well as almost everything else that I see, is time. I often give it time. Most of these, even if they do need an x-ray or would maybe even need to be casted, if it doesn't get looked at immediately, it's truly not an emergency. So I'll often tell them, like, if it happens at wide game, which is the most common time, they're running around and they sprain their ankle, I'll often say, here's an ice pack, go elevate it in chapel, like put your foot up in chapel and come back and see me after. And I'll often have them come back. And if I'm on the fence, I'll have them do that a couple times, sleep on it, let's see how it looks in the morning kind of thing. And the reason for that is they'll often just forget. And if they totally forget and by tomorrow they're running around like no problem, it's probably fine. If they do come see you several times, then it may be actually giving them more pain and grief. Other than that, we are looking for the swelling and the Ottawa ankle rules and stuff like that. But those are just things I do. I often will say, let's see how this looks at whatever the next time is. Let's see how this looks at lunch, or let's see how this looks at supper. And it gives them that ability to come back and see you again. It builds the relationship a bit and just gives a bit of time for you to see how it's developing. So That's just a trick that I like to do. Homesickness. We get a lot of homesickness, and distraction is the best medicine. And why I say that is because if it's just a basic homesickness, we try our hardest to have kids stay the whole week at camp. And 99% of the time, they are so happy they did, and we can keep them there with just a bit of distraction and really just encouraging them to. The number one thing we do avoid is we do avoid phoning home. If a kid phones home, you can almost guarantee they're going home. As soon as they hear that mom's voice, the waterworks will start and they will just want to go, and no parent is going to be able to be able to turn that down very well. So what we try and do is distraction, the time thing again, like, yeah, I know it's really tough tonight. Here, I'm going to, give you a Tums for your tummy and come back and see me in the morning. And then in the morning you can say, oh, okay, if we really need to call, well, I have to talk to my director and we'll have to make a plan. Okay, so how about you go do your skills? Because you have some really fun skills this morning, and come back and see me at lunch. And then generally through the day, they're quite fine because they're fun, they're entertained. It's the night that's a bit trickiest. So a little bit of distraction, a little bit of very lovingly putting things off just really goes a long way as far as treating homesickness. And usually by the second or third day, they're just fine. And usually by the end of the week, they're so happy they stayed. Too much sun. We get this a lot, especially on hot weeks. We do often get a lot of heat exhaustion. I would say we get almost no heat stroke. I don't think I've ever seen a true heat stroke. We avoid using the word heat stroke around the campers and staff, obviously, because it's a condition that's the severe version of heat exhaustion, and we rarely get to that state. But heat exhaustion is super common. They're tired, they're weak, maybe getting headaches. To you, they're going to often present as headaches or a bit of a nauseous feeling in their tummy. Their counselors are more going to get the tiredness, they just are, lethargic and not moving as much. So we just encourage water, 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 hats, sunscreen, water. If they come into my office and they have a headache, even if I think it's not heat exhaustion, I usually make them go down a couple little glasses of water before I give them anything. That's just kind of to make sure they're hydrated, and that'll often help. If they're really quite heat exhausted, I'll let them kind of sit in my nurse's cabin, which is air conditioned, maybe even get them a freezy and cool them down a little bit in the freezy with the hydration and stuff like that. It's usually enough to kind of turn it around, maybe a Tylenol, and they can go back out and play. If it's still too hot and it's just too hot of an activity, they're welcome to go to their cabin and have a rest, but you do have to let their counselor know. So one of the counselors will likely stay in there with them. So just keep those things in mind. Obviously, if we do get to a heat stroke category, so they're confused, they're slurring their speech, they're like sweating profusely, and their actual body temperature is up, and we will have thermometers in our little bags that we carry around. Obviously, we're going to deal with that. Loss of consciousness, obviously, we're going to deal with that as a 911 call. So if we get to that stage, we are now looking at taking them into the hospital or even potentially 911ing. Heat exhaustion, we're hydrating, we're giving them a hat. Sometimes there's lots in lost and found, and we're cooling them down and letting them have a nap if they need. Pain assessment. This is one of nursing's most difficult skills, I think, in the field here in the hospitals and otherwise. The balance of what are they telling you versus how are they presenting, because their experience is very real. So it's not to ever say that what someone rates their pain at isn't true, but any nurse who's nursed for a long time knows that there's more to the pain puzzle than just their pain rating, and we do have to look at the other things that are going on. And kids are no different. Pain assessment, is it homesick related? Like, is this pain somewhat psychosomatic? Now, that's not to discount it at all. Psychosomatic is a powerful force, and it's not unreal by any stretch. But is it related to that? Or is there an actual presenting thing that's causing this pain? So just kind of talking it out, looking at the camper as a whole, the whole picture. Sometimes pain is contagious too. And if, someone has menstrual pain, all of a sudden now all of the 14-year-old girls in that cabin have menstrual pain. And so just having a bit of wisdom as to what to treat and what not to goes a long way. That being said, everyone nurses differently. So there's times that I have given pills out when I'm like, yeah, I think you're probably just fine. And you know what? A dose of Tylenol won't kill them. And then there's maybe other times where they maybe probably needed a dose of Tylenol. And I was like, I did my good time tactic where I was like, you know what? I don't have anything on me right now. Come back and see me at lunch. You know, it's all just based on your situation and your nursing judgment, but it's just kind of something important. Allergies, food allergies, I will often make a list and give it to the kitchen. However, they will already know. Someone does go through and give the kitchen all the food allergies. Seasonal allergies, lots of kids have meds scheduled, especially while they're at camp and outside and with animals and all this kind of stuff. And then many kids will come with PRN seasonal allergies. Those kids I will check in with usually on like Tuesday, Wednesday, and just see how they're doing if they haven't come to see me, just so that I kind of keep a ear to the ground on what's going on with them. We do stock Benadryl cream, so for bug bites and little like rashes and itches and stuff like that, as well as liquid and pills for, say, someone who maybe does have a bit of seasonal allergies but didn't bring medication because they very rarely use it. But now all of a sudden I'm with horses all the time and now I need it. So we do have that available. EpiPens. So EpiPens is something that we deal with on an individual case-by-case basis with the kids' parents as to what we want to do with that EpiPen. So we carry extra EpiPens. So the ones that the camp has purchased will be in our backpack that we take with us kind of wherever we go. As well as the kids usually bring their own EpiPens, obviously those with severe allergies. And so we kind of follow suit with what the kids and parents do at home. So if they're a kid that carries their EpiPen in like kind of a little bag with them, to school and around in activities, absolutely they can do that. They can take their little EpiPen with them in their little bag if they have one, for sure. If they tend to like, oh, it lives in my backpack, but I don't usually have my backpack, or they keep it, but it's not necessarily within arm's reach at all times, then we can let the EpiPen stay in the cabin. And we do have to talk to their counselor about that. So after registration, I usually make a little cheat sheet for all of my counselors about any medical concerns. And so that would be on that this kid has an allergy and an EpiPen, and it needs to stay in their cubby. So in each cabin, there's one cubby that's higher up, kind of out of the way. That's the counselor's cubby. And that's where if the kid were to say, have a peanut allergy, camp's obviously peanut free, but maybe some kid, trying to be nice, thought he'd bring some Snickers treats for everyone and passes them out. Then the EpiPen is there and ready to go where they need it, kind of right away. So that's what the plan with that is. Colds and flu, what to keep and what to send home. This is a bit more tricky post-COVID. That being said, generally, if they're, too sick to go to school, then they probably should go home for a day or two. So if they're, and I kind of mean like if they're too sick to participate and do the activities and things like that, it means they probably should go home. Little coughs, little sniffles, we're probably going to keep. All of our COVID tests did expire, and so we did have a chat as a team and decided that we weren't going to purchase more because most people are not testing at home. And just based on the numbers in the last 6 months and just the very, very low hospitalizations and ICUs and stuff, that the type of COVID that we have going around right now is very low risk to be serious, even if they were to say pass it on to family and friends. So we did decide that we're not going to be testing for COVID. But if they're too sick to, participate and do things, they can go home for a couple of days and come back. That being said, if it's just something small or little, we're probably not going to send them home. Nausea is also one that we do have to kind of assess and think on and consider. So if a kid throws up at camp, it can be for a variety of reasons. Lots of times they ate way too much junk food. We do get that one from time to time. It can be related to heat and stuff like that, or it can be a little flu. So I generally, if they throw up, basically I give some Gravol, I let them have a nap, either in my nurse's cabin or in their cabin. And then if they wake up and they're feeling better and doing okay, then they're good to stay. If they wake up, they're still sick, or they wake up and they're throwing up again, that's usually around the time I probably send them home. So our goal is to keep kids at camp, but our goal is not to keep kids that are too sick at camp. Mental health, we do get this, I don't want to say more now. It's a bit like it's an ever-evolving situation. So if you're in the older camps, you're going to see this a little bit more. So you're going to have some anxiety and panic attacks. So what I do for dealing with anxiety and panic attacks, and I'm going to say without respiratory involvement, if it gets to the point where they're struggling to breathe or even approaching that, like if they have respiratory involvement, now I'm going to look at it from a respiratory distress situation. But if they have anxiety and panic attacks without that, so they're just worked up, they don't feel comfortable going to their skill, something, they're just not they're feeling anxious. And this can happen at camp. Like we've literally taken their cell phones away for a lot of these junior teens, that in itself is hard. So basically all I do is a calm, relaxing presence. I allow them to just hang out with me and spend time with me, and I just chit chat with them. I do some mindfulness activities. So that's just bringing them back into their body. So having them wash their hands in really quite cold water and just telling them to like feel the cold water. Or there's activities like the 5, 4, 3, 2, 1. What are 5 things you feel right now? Like the chair beneath you, the ground under my feet, the material of my pants on my legs, hair kind of blowing in my eye. Those are things you feel. What are 4 things you can touch right now? What are 4 things you can hear? Well, I hear crickets in the distance. I hear leaves rustling. These are all things just to get their mind out of the circling in their head and get them kind of back into their bodies a little bit. So those are sometimes very useful. If you ever have someone come in with, say, depression or hard conversations, there's a whole variety of hard conversations that can be had. And sometimes as the nurse, we do have the blessing to be able to have a nice, develop a bit of a nice relationship with these kids and get to know them a little bit and care for them. And that may spark them to want to share some things that they're concerned about, whether it be challenges at school or issues at home or potential abuse or, suicidal thoughts or all kinds of things that kids can struggle with nowadays, which I'm sure you're not, ignorant of. So the important thing is to be just using our best judgment and best action. If any, these conversations need to be reported to the executive director. Now, that doesn't mean you need to give every last detail, because that is not important, but you need to tell them that, say, you had this hard conversation or things like that. Obviously, if there is a continued threat to them, or they are a threat to themselves or someone else, or someone is a threat to them, that needs to also be told to the executive director, and then will then be escalated to dealing with it in an appropriate way, which usually means us reaching out to social work. That will be done by the executive director, however, but that will be in conjunction with us. So just be aware and prepared for those conversations that could happen, and then you can document them as well. The drugs. These are the drugs that parents let us give their kids. There is a little tick box on their sheet, and we'll show you on the app, if we can get the app up and running, that's our goal, that these are the medications that parents can give us permission to use. They don't always give us all permission to use all of these. Most parents just tick yes, give all, like yes to all. Lots of parents will go through and pick the ones they're comfortable with and not the ones they're not. Like if it's a boy, they may not give us permission to use Midol. This is no problem to us. But we do, anytime we give a medication, we do double check to make sure that we do have the parent's consent to be doing that, because these are all over-the-counter medications and the parents are giving us consent to do this within our best judgment. I won't go through all of these, but here are just some charts on dosing. So this is a resource for later if you need help with dosing. That being said, it's literally listed on all of the bottles. So that is all, like, I find it easier just to look at the bottle, but they're also here. So if you ever need a resource, how much is a good amount? This is where you can look. I pulled these off all of the drug companies' actual websites. So Tylenol's website, Advil's. These are just the different drugs we give. You'll see them in the cupboard. Oh, I apologize for the formatting again. Pepto-Bismol, I did chat with a pharmacist that we are connected with, and he says, generally speaking, it's not good for under 12 years of age. And that's what it's listed as. So 12 and up is all we can really use it for. Tums is a good option for our younger kids. We do have cough syrup, Halls and Fisherman's Friend. Drug administration and charting is going online. So we are attempting, and we've been working for the last couple of weeks to get our app up and running. We have used it in the past, but at times it does have some challenges. So we're going to try and work through those. That way it gives us the ability to take our entire chart with us in our book bag wherever we go. So I do think that's a huge plus, because the main camp binder can get pretty big because we have like 100 kids. So we're going to aim for that, but someone will be there with you if it's your first week on Monday to kind of go through the charting with you. You'll have to set up your own account because obviously all this online charting is secured, like HIPAA secured. So you need a login and an ID to get in. And so we'll get you all set up with that once we get there, and it's fairly easy. I have the tips. I may jump to schedule and come back to these a little bit because I will talk about these a little bit more as I talk through schedule, I think. And yeah, we'll jump to emergency preparedness. So early 911 is the key. That's really the message we want to get with this. If you're concerned and feeling a little out of your depth and like, what do I do? What do I do? Panic mode, early 911 is always the answer. No parent will be upset that you called EMS, when you didn't need it. That being said, we don't EMS, sprains and breaks. We can drive those in. Anything that's not emergent, we can take in. We can just drive in. So the thought process is like, will they deteriorate on the drive? And if yes, phone 911. If they won't, like a sprained ankle is not going to get more sprained on the drive, we're good to go type thing. Hopefully, but never, we prepare for an anaphylactic reaction, a respiratory emergency, a possible head injury, a major bleed, a seizure, cardiac event. So we do have an AED, and we do have a Narcan kit available just in case of a narcotic overdose. And we'll cover those. So anaphylaxis, immediately call 911. So step one is to yell out for 911. And while you're doing that at the same time, it's getting the EpiPen. So if the kid's EpiPen is at hand in any degree, use the kid's EpiPen, first choice. We have backup EpiPens in our bag, so they're always with us. So if the kid's EpiPen is not close at hand, say they got bit by a wasp and they're down at the playing field and their cabin's a bit away and that's where their EpiPen is, that's why we have them in the backpack. Administer ours, because even if they're not looking that bad, let's not wait to run and go get theirs kind of thing. Let's just use what we have when we need it. And then you can call for the trauma bag. So up in the ranch house nursing station, and on an orientation when you get there, we'll show you where this is. There's a trauma bag. In the trauma bag is a bagger, a tank of oxygen, an adult non-rebreathe and a pediatric mask, oral airways in case they lose consciousness, and that's all those things. There's also stuff for bleeding. So there's like a little kit made of gauze and stuff like that for bleeding. And then there's a splint and odds and ends like that, a flashlight, a blood pressure cuff, paper and a pen to write stuff down, stuff like that. So call for that trauma bag and administer oxygen as needed. What we will be carrying with us at all times is our nurse backpack. In our nurse backpack will be that EpiPen, like I said. There will be a Ventolin MDI and spacer, which we'll talk about on the next slide. There will be a little SAT monitor, heart rate monitor, so that we can check our kids' oxygenation if we need, if there's any sort of an emergency. There'll be a pen light, so we can look in people's eyes. And then there'll be stuff for, dressing small bandages and little things like that we can add. But those are going to be with us at all times. So we can administer oxygen based on that oxygen saturation. Like those new little portable SATs, I think those are a great little add-in. I'm really happy that we added those this summer. Also have the camper lie down, stay with them, and just monitor pulse and breathing. So because they've used their EpiPen, 911 does need to be called. And because you may need to give a second dose, 911 will direct you from there, though. They are great. They are going to tell you, they'll be asking you for assessments. Okay, what's their heart rate like now? Okay, what are they doing now? And they'll really be kind of helping you and prompting you through that. And if it's, taking a bit for the ambulance to get there, they may direct you to give another dose of Epi. Lots of the pens have 2 doses in them. We also have extra pens if we need. So those are great to know. A respiratory emergency, again, someone call 911. If someone is prescribed a Ventolin inhaler, we're going to give that. If it's not on their person, we have a backup. So that's so we don't have to run to their cabin to go get it if they're needing it. We do have a backup. Now, that being said, it's a one-time use. So if the kid just needs their puffer, but they're totally fine and breathing totally normal, we may have a counselor run back for it. So use a bit of discretion there. If they don't look like it's urgent at all, don't use ours, go get theirs. But if they're looking like they're starting to struggle to breathe in any capacity, I'd rather you just use ours. We can get another one. That is totally okay if that prevents a true respiratory emergency. You can call for and if it's to the point where they're, needing support and they're, we're tripoding a little bit and they're puffing away pretty good, call for the trauma bag. We have that oxygen in there. We can give oxygen as needed. You will have that, sat with you already. So as soon as you have anyone with breathing issues, we can just clip that on there and just watch how we're doing, making sure everything's okay. And the same thing, stay with the camper and monitor pulse and breathing. So someone's, respiratory emergency is like, with a camper, make sure that someone's with them and reassuring them and telling them it's okay, and doing that, because they'll also they get worked up too. So sometimes respiratory emergencies are worsened by them feeling anxious and overwhelmed, and that inhibits their breathing further, and it's just kind of like a cascade from there a little bit sometimes. Head injury. These are head scratchers. Sometimes people come in and say, I hit my head. Okay, tell me more about that. So that's when you'd really start your curious questions, and you're just like figuring out what happened, what the experience was like for them, and lots of questions for head injuries is what I do. So criteria for needing to see a doctor: is there amnesia of the event, or immediately following type thing? Do they have an altered LOC? Obviously, we're going in. Is there C-spine pain with or without movement? Like, does it hurt for them to move their head at all? Hearing loss and visual disturbances. If they're start vomiting, and this could be later on, like an hour later or farther, like if they start vomiting, we're going in. Persistent headaches not responding to treatment, or obviously any like major lacerations or injuries, that like a fracture that needs treatment, like sutures or something like that. All of these things we are going to take in. Many of them we would maybe even 911 for. So use your judgment if you feel like there's the possibility that they're going to decompensate or it will get worse in the time it takes to get them into the hospital. Feel free to call 911. That being said, sometimes if, I have sent kids in without calling 911 because they actually seem pretty good. They just were on that cusp for me, and I did want to, want them to get seen. And so we did drive them in. But that is, 911 is an option. Head injury, loss of consciousness. Obviously, if there's a head injury and they lose consciousness, someone calls 911, you call for the trauma bag and use it as needed, and we're staying with the camper on the phone with 911, monitoring them. Even if they do come around, obviously we are still just going to continue to have 911 take them into the hospital because they will need to be assessed. Major bleeding, risk of shock. So major bleeding means major, if they get a cut on their ankle and you're just going to bandage it up. But, this has never happened at camp to my knowledge. If there's ever like a major bleed, like a serious bleed, obviously it's kind of the same as you would respond if you were at home. You're going to call 911, you're going to apply pressure to the bleeding area, and you're going to apply firm pressure to the bleeding area. You're going to call for the trauma bag, and you're going to administer oxygen as needed. If we're looking at getting into a shocky type state, we're going to stay with the camper and monitor pulse and breathing. So just the same as everything else, and 911 is great. They are going to talk us into what we should be doing and what we need to be doing. With all of these situations, we do have blood pressure cuffs in the trauma bag. That being said, feel free to get a blood pressure when all of these other things are done, and if you're just waiting and stuff like that, it's perfectly fine to get. We haven't made it a priority because a blood pressure in a child is the last thing to go. So your oxygen saturation, your heart rate is like on that O2 sat monitor is a really good indicator of how they're doing. So we really are going to be trending those more importantly or first before we really trend the blood pressure. But the blood pressure cuff is there, and if you are comfortable and capable of using it, you are welcome to do that, and you can report it to 911 as well. They may ask you for it, and we have that resource available. Seizures. I have had someone seize at camp. So basically, there's actually not a lot we can do for seizures at camp. Once the ambulance comes, they can medicate and stuff like that. So basically, you have someone call 911. We're basically going to go to the camper. We're going to roll them to their side. We're going to protect them from injury, which may mean a pillow under their head, making sure there's nothing in their mouth they're going to bite or choke on. And we're going to reassure that camper and stay with them. Often the seizure will end long before 911 gets there. They may be in a postictal state, so that's when they're like sleepy and still kind of out of it. They may not. But if they have seized at camp, we will be calling 911 and sending them in. The only exception to that is if the parents talk to you beforehand and maybe say something like, they seize all the time, please call me if they do, or something like that. I've never had that, but conceivably they could. And so if they have a special note like that, then yes, we would call the parents first before we call the ambulance. But other than that, if someone seized, by the time ambulance get there, they may have fully come to, but they should still go in and be assessed. The fun stuff. So that was all the scary stuff. That is not going to happen. We are praying hard. We are covering camp in prayer that none of those things happen this year, but we are prepared if they do. That's our goal. But for the most part, we want your time here to be really, really fun. We want you to enjoy your time here. And as much as it is a blessing to us, and it truly is that it's that you're coming to serve, we want it to be a blessing to you and your family. So I'm going to go through a bit of the schedule, what your day looks like. So if you are new to camp, you will likely come either on Sunday evening. You have the ability to come that night before to get set up and settled and stuff like that. There's a staff meeting that night that you can go to and meet the staff that you're going to be working with that week. If you can't make it Sunday night, that's fine. You can go out on Monday morning. Registration is at 9, so you should aim to be there by 8 a.m. so that you can kind of get set up and ready to go. And what that first day is going to look like, basically you're going to have a little table, and as each little family goes and they, pay their registration money and set aside money for tuck and do all the things, at the end they're going to come to you and you're going to ask them, do they have anything they need to ask the nurse about? And if they say no, you're going to be like, okay, great. Do you have any medications in your bag? That includes, Tylenol, Advil, Tums, anything like that that's kicking in your bag. Hopefully they'll say no. But there's a possibility that they could say yes, and you'll say, you know what, you don't need those in the cabin. We do have a rule that there's no medications left in the cabin. So just really feel free to bring those back to me, and I always make a note so I can hunt them down later if I need to, or turn them over. If they have their bags, they may just turn them over. I say usually send them home with the parents. It's less stuff for you to hang on to. If it's just basic stuff that we already stock, say, you know what, we stock all that. We will deal with that for you. So anyway, if they say, nope, they don't need to talk to the nurse. Nope, they don't have any drugs in their bag. You say, have an excellent week. I am here if you need me. My nursing station is down in the valley and at the top or whatever. And then send them on their way. They'll go get all settled in. If they have a medication, we'll use our little computer. We'll input the medication so that we have that all ready to go. Sometimes parents will want to talk to you about little odds and ends. Maybe, they wet the bed, or maybe they're a little bit anxious, or a variety of things that parents may want to let you know. I always make notes of that on their chart so that I can kind of reference that material later, because there's 100 kids. I will not remember that tomorrow off the top of my head. So I do like to have it down in writing. We take all of their medications and we put them in little sandwich bags, and there'll be little like white cue card types things that we label the bag with what's in it. And then you can color coordinate it if you find that easier. There's a few different ways that people like to do it. I like to color coordinate. So, say blue is AM and, pink is HS, and then there's sometimes a few lunch or supper or tucks, and maybe they get a green or something like that, just so that it's a bit easier and faster for me. But whatever system works best for you, you are welcome to develop that. And so once all the kids go and they're all settled in, they're going to start their skills and do their things. That's where we take about an hour or two, maybe even a bit more, depending on how long it takes to just organize our week. So we're going to organize, make sure we have all those cue cards filled out properly. We're going to sort out whatever system we want to do. I often go through all of the campers and I will make a cheat sheet for all of my counselors saying, oh, in your cabin, you have this kid, he has ADHD, so he takes a med at breakfast. You have this kid, they are allergic to wasp bites, so there will be an EpiPen in your cabin. Whatever other things. This kid takes no meds, but his mom says that he's sometimes bedwet, so just, be compassionate about that. And so I have these little cue cards made. Then usually at supper time or next morning at staff meeting, I will give those cards to them and I will kind of go through them, be like, did you get that EpiPen? Is it in your cubby hole? Or just kind of cover that with them. Then I know I've touched base with all of them. Then they also know a little bit better who I am, because although they work together all summer, we're off in there for just 1 week. Then they know who I am and they can come to me if they have any concerns. So that's kind of how I set up my Monday, is I spend some of my Monday just getting that all set up. Once you're all set up, then you're good to go. You're going to kind of run each day camp as normal. And so this page has the schedule of what I consider as like camp as normal. So basically how it goes is I didn't put times because each camp runs different times based on the age group and how many skills they have and stuff. So this is just kind of a general overview. Breakfast is super busy, especially at main camp. There's 100 kids, so you're probably going to have 20 scheduled meds. I have the kids line up at the door so it doesn't get too chaotic. I definitely run a system where I have all my little baggies with their meds ready to go. And then I have a basket. So once I've dispensed their med and given it to them, I seal it up and I put it back in the basket. So I don't actually do my charting until after, just because there's a lot. So I use the basket as this is complete pile. And then what's on the bed I know still needs to be given. So at the end, if there's still 2 there, I may have to hunt those kids down and be like, okay, and make sure you do this before breakfast ends or it gets more tricky. I know I've done it before. I hunt them down and be like, I have to find this kid and then give them their med. The easiest way to do that is just go directly to the program director and say, I have this kid and he's in this cabin. And usually from there, they'll be able to find them fairly quickly for you. So feel free to reach out to the program director to do that, because finding kids at breakfast can be challenging. After that, you're just going to kind of relax, clean up breakfast, eat your own breakfast. One of my little tips was, because breakfast is the busiest time, before kids even come up to the ranch house, I go to the kitchen and I make my own little breakfast plate and I save it for after breakfast and I can eat it after breakfast. Or if you have time, you can eat it before. But I just make my own little plate because sometimes breakfast is busy enough by the time you're done all your work, all of a sudden breakfast is packed away and you're like, oh, so sad. That French toast looked delicious. So that's one little tip. Shortly after that, the kids are going to have chapel. Chapel is the time that the nurse does cabin checks. This is my favorite time of the day. And so what that looks like, and someone will go over this with you, hopefully on your orientation day. So you're going to take your little gator, you're going to hit each cabin, and you're just going to kind of basically go into the cabin. You don't have to do a deep dive for cleanliness, and see how clean it is. The expectation is they cleaned up their cabin before chapel. They do this every day. It's an important part of the program because otherwise the cabins would fall into chaos, and we do not want that. So we get the joy of checking them. So we go in, it's out of 100 points. So there's there's a little ticky sheet you can use. I don't use it super seriously, I'm not going to lie. But I go in, is the lights off? Is the garbage empty? Is stuff mostly put away? Are beds made? And, if there's a couple things out of order, usually I'd be 90 out of 100 or something like that, 100 out of 100. Often they're going to do nice things for you too, because they are competing for these points, because there's a prize at the end of the week for the most points. So you may get little kind notes or little treats, or their shoes set out like a heart, or maybe even a Bible scene of stuff they're learning about set out with their teddies. I love those things. I love encouraging that creativity and that funness in camp. So if they ever write a note, I always have a pen. I will write back. If they do little things, they get extra points. So, if a little letter will be maybe 5 extra points, or, they've set up their shoes in a cool way, maybe 10 extra points, or, they've given you a candy, 10 extra points. But if they do kind of like a Bible theme, or they've clearly put in more work to do something kind of cooler, or in any time they kind of tie it to what they're learning, I tend to give more points. 15, 20, 25 points is kind of my top. And that's based on what they do. The more you encourage it at the start of the week, the more they'll really get into it. And I think that's a really fun part of camp. So I hope you enjoy doing that. Lunchtime is pretty chill, not that many meds at lunch usually. It is at the end of lunch, your time when you give cabin points. So you go up and you basically talk about what you gave each cabin. So you may be like, bridle was a little bit dirty, guys. You didn't put everything away and your lights were on, 80 out of 100. And then maybe, I'm generalizing here, which is maybe rude, saddle horn, you did a really good job. Everything was clean. And you left me a really pretty little scene set out of, teddy bears and Noah's Ark, 120 points. I do try and keep it quick. The whole thing should take for sure less than 5 minutes because there is a lot going on in the day. But that is a fun way for you to connect with the kids a little, and then they see you, even the kids that haven't come to see you for meds or anything, know who you are and can come approach you later. So I think it's actually really valuable. Sometime in the afternoon, set between the two of you, there is a medical meeting. So you guys do have to set that up. It is a time you get together and you basically have time to chit chat about any challenges, struggles, and laugh about the silly things because there's lots of that. But that way, if there is some kids that you're routinely seeing, you can inform them about homesickness. That way, both people are on the same page. If you ever need to phone for help, they already have the background of maybe what's going on that week. And it also lets you guys get to know each other because they are your best resource. If you're ever even doing the head scratching, like, oh, this ankle, should I send it? Shouldn't I send it? I don't know, which I do a lot. Having that other nurse to be like, hey, you free? You want to come over and have a look at this? Or like at supper, can you pop over and have a look at this? That is a great resource. There is 2 of us out there. I am a big talker, as you can already tell. And so I love to soundboard off people. So feel free to do that. That would be great. Supper, also pretty chill. And in the afternoon, when you don't have, say, the medical meeting, go do what you like, explore the camp, have a nap. If you have your family there, take them canoeing, take them to the wall. As long as you got your little medical backpack with you and an ability to transport, so a gator or something like that, you're good to just go do what you would enjoy doing. So yeah, come back for supper. Supper's pretty chill. And then you get to enjoy evening chapel. So I would encourage you to go enjoy evening chapel, be encouraged by the message, just get joy from the kids singing and laughing. I personally try and prep all my bedtime meds before chapel because after chapel is kind of like the influx of kids. They come get all their stuff and I do like to be prepared for that. So evening meds can be fairly busy too, especially at main camp. You have a lot of kids coming and even coming in groups. So one kid needs their meds and 4 kids come because they're on their way back to the cabin. So sometimes evening meds can be kind of busy. And then I say have a good sleep, which I do hope you get a good sleep each and every night, but you are obviously on call at night. So keep your cell phone by you with the volume on. So if someone were to need you in the night, they can get a hold of you. As you meander about camp and do the things that you enjoy doing there, on the nursing station, we do have little whiteboards on the door where you can kind of jot where you are. So if in the afternoon you're at skills, you can just say skills and you can just leave your cell phone number for people to contact you if you need. There is a little first aid kit outside of the main nurses station. So if they just need a Band-Aid, they can just grab a Band-Aid themselves. But if they call you, we just come back and help them out with what they need and then head back to whatever we were doing. So that's the basic schedule. At any point, if you have questions or you just aren't sure about something, or you're like, where would I find this? Or kind of anything like that, you have a few options of people you can reach out to. You are not alone there by any stretch. So feel free to call the other camp nurse at any time and just be like, hey, what about this? Often you'll be working maybe with a nurse who's been there many, many weeks and they will have that experience. Sometimes you won't. You'll be with another new nurse and you guys can figure it out together. Or next you can go and you can talk to the executive directors at any time. They are there to support you and they would love to answer any questions you have. And I'm also available. So feel free to call or text me. I try and do well with my cell phone answering quickly. Sometimes I don't do well. So if you text and I haven't answered, and you kind of really need an answer, feel free to give it a call. If it's during work, feel free to give extension 4118 a call. That's my office number. You can call me here too, because we want you to feel supported. We want you to have a really good experience and just want to come back next year and just love on these kids. And so with that, we just really for your willingness to serve at Dallas Valley. We are truly blessed and grateful that you are here, and we really want you to know that. And we can't wait to see you and meet you this summer.